Okay, so first and foremost, my name is Diane Capilong. I'm the return to work consultant here at Motor Trades Care. So we are a subsidiary of the Motor Traders Association of New South Wales. So we are the WH&S experts. So my background is in workers' compensation. So I've worked in the SME, so small to medium space. Moving into the specialized field, which I particularly did psychological injuries and also disease-based claims. Moving into the return to work space, so I was an employer representative, such as many of yourselves here today, and also now being in an advisory role. So that's a little bit of background about me. Okay, so in saying that, let's move forward. Okay, so what we're going to touch base on is our purpose. We're going to break down psychological claims, understanding the impact that it has on your business and the workers involved, how to support those going through a psychological injury, identifying risk and hazards within the business, and creating a safer workplace for your business as well. Okay, so with this disclaimer, I will keep that up for you guys. I'll quickly read that out to you. So the information provided by Motor Trades Care, we, us or are, regarding psychosocial risks and psychological injury workers' compensation claims is intended for general information purposes only. It is not intended to constitute legal, medical, or professional advice. We do not provide specific legal or medical advice as we are not licensed professionals in these fields. The content shared is based on our understanding and interpretation of available information and resources and may not be applicable to every situation. Any discussions or references to workers' compensation claims, psychosocial risks, or psychological injuries should not be construed as an endorsement or guaranteeing outcome in individual cases. Each case may vary based on specific circumstances, and legal or medical advice should be sought from qualified professionals or personalized guidance. Furthermore, while we strive to ensure the accuracy and reliability of the information presented, we cannot guarantee that all content will remain current or error-free. Participants are encouraged to independently verify information and consult with the appropriate professionals before making decisions or taking actions based on the information provided. By assessing or using this information, participants acknowledge and agree that Motor Traders Care shall not be liable for any damages or losses arising from the use of or reliance on the information presented herein. Okay, so essentially what we're trying to say there is, as you may be already aware of, the human brain is very complex, especially in the psychological realm. There's constant research being conducted by medical health trained professionals. So information is always evolving. In saying so, we're not here to give personal advice. We're here to give general advice, particularly around workers' compensation. Just a little bit of housekeeping as well. So we have turned off the chat box for now, but we do have the Q&A. So feel free to pop down any questions there. And if we do have time at the end of the segment, and again, I acknowledge that there was a bit of technical difficulty, we will still answer those questions, even if we do run out of time, but we'll send it through with our show notes there. If you have any particular situation or circumstance that you do need advice with, feel free to reach out to me. I'll be providing my contact details later on. Okay, so let's get this show rolling. So the purpose of today is to navigate and understand what is psychological injuries when it comes to workers' compensation. So looking through the lens of the workers' compensation there. Now, breaking it down, understanding the impact, the risk, and the hazards that places within your business and the people around you. So we're going to focus on that awareness, so that way you understand that as well. And also, we're here to provide guidance and support and advice around that, so you know what to do and how to support your people. Okay. So we're going to skip this segment because we did have that little moment there. So what we want to understand is if you or someone that you know had a psychological workers' compensation claim. Now, some of you may have experienced that, or maybe in the process of experiencing that. I want you to bring that to your forefront because we're going to talk about certain situations or circumstances that might actually also relate to you as well. Relate to you, apologies. Okay. All right, so let's go into defining what a psychological injury is. Now, what it is, according to the Workers' Compensation Act, so that's the 1987 Act, a psychological injury is an injury that is a psychological or psychiatric disorder. The term extends to include the psychological effect of such a disorder of the nervous system. Now, two key call-outs I want to bring to your attention here is when exploring if a psychological claim is covered under the workers' compensation scheme, there's two main components that the insurers look at. And that is, one, does the worker meet the definition and the criteria of a deemed worker? And secondly, is work the significant contributing factor to a psychological claim? Now, this is where it could get a bit controversial and different people have different perspectives about that. But there is a process which I will tie in a bit later of how they go about investigating this to understand that answer there as well. So that's a big important thing as well, especially for everyone in the room here today. There's sometimes this misconception that, we understand that people go through personal things and sometimes if they could bring it into work or, different situations and circumstances may be questionable whether or not it is actually a workers' compensation claim or if it's classified as that. So that's one of the main factors that they look at. And particularly as well with psychological injuries that occur in response to a reasonable decision or action taken by the employer, the worker may not be eligible for the workers' compensation. Now, if you want to look more into detail, I'm not going to touch base on it in today's webinar series, but if you look into the Workers' Compensation Act 1987, if you go to section 11A, that will break down what is and what isn't covered under that as well. All right. So, secondary psychological injury. Now, this is something that may not be familiar to a lot of people. So what that essentially is a secondary psychological injury means a psychological injury to the extent that it arises as a consequence of or secondary to a physical injury, okay? And what this is considered as is from an initial incident occurring or illness, of course, through the course of their recovery, they end up developing a second psychological injury. Okay, now this can manifest in different ways. Now we understand just again, the human body is complex. Return to work timeframes, the worker might come in and realize, okay, this is a bit more difficult. They might have pre-existing conditions. They might have personal factors, work factors that can actually affect them from returning back to work and therefore have an impact on their mental health. So in situations like this, you usually see this with more long-winded claims, a worker that hasn't been to work for a couple of months to a couple of years. That's where you could see that manifesting as well. Okay. Now, let's look into the impact of psychological injuries. Now, let's look at your business. Now, when it comes to this, here's a will, and it has certain pillars of different areas of your business. Now, to help break this down and help you understand as well, I'm going to give you a situation and scenario. Now, I'm going to keep it very high level so we don't unpick too much into this. So in this situation, you've got a worker and they've gone through a bullying and harassment claim against their manager. Okay, that's the situation here. Now, let's put that into perspective when understanding how that could affect your business, right? Now, let's look at workplace culture. Going through a situation like that may affect the workplace culture because if it's a leader of the business that has potentially bullied and harassed, one of their team members, their staff, that could affect the rest of the team. So, they might feel uncomfortable to come into work, questions will be asked. That could also affect leadership, productivity. That's a couple of things that would tie into the workplace culture. Work health and safety. It raises a question: do you have a safe working environment for your workers to come in? Particularly if, in this case, when you go through a bullying and harassment claim, there's questions that needed to be asked. But if it was indeed true, do you have a safe workplace? That raises that question. The resources as well with your leaders. Do you have enough resources within the workplace to help them through it as well? Maybe they might be a younger leader, and when I say younger, they might not have that much experience in leadership. Maybe they were having a bad day. There may be certain circumstances. Maybe they didn't get enough training on how to be a good leader. Do you have those resources to support your workers? And internal processes as well. Oftentimes we may see, especially for our smaller dealerships or smaller businesses out there, they might have processes and procedures, but because they have only a few staff, they might have a close bond. They might have a certain type of relationship with their the colleagues as well, and that might make it difficult to actually go through a process where you have to mediate the situation. Process a grievance. Maybe your company doesn't have those updated policies and procedures as well. That can make things difficult. And leadership. Again, having one of your managers causing that effect on their people, that could affect all types of leadership. Maybe it comes from the top down as well. Having that proof check of, okay, have we educated our leaders? Are we providing that support to our leaders as well? That's just some of the implications it can have on your business. Now, let's look at from a worker's point of view. Okay, in that type of situation, when a worker goes through bullying, harassment, or something has been done to them, you'll start to see a chain reaction when it comes to their behavior. So what you might start to see first and foremost is a relationship breakdown. They may not be comfortable to go speak to their manager. And particularly in some cases, it's not straight away that they would bring up the issue. Again, it comes down to the type of organization, the type of workplace culture it is. Some of the times they might just carry on with work and come into work and just keep it going. And if they don't set those boundaries with their manager might feel that it's okay to treat them like that. So what you'll notice straight away is a relationship breakdown. They may not feel comfortable to actually speak to their manager. Then you'll start to see, social withdrawal. They no longer want to talk and communicate with their colleagues. You'll see a shift in their behavior. They might even become reactive as well. You might get them at a certain time, you ask a simple question, and then all of a sudden they think that it might lead to a conflict. So they react to you in a defensive manner. Oftentimes you see that. And then through the flow-on effect of that, you'll start to see changes in their work performance. So you might notice that they're taking a lot more breaks, or they're missing deadlines. They become really forgetful about things. And that will trickle into their performance. You might need to bring them in and say, hey, what's going on? We noticed that you haven't done your work. And to a point, it might even lead up to absenteeism, where they no longer feel comfortable to be at work and they just want to escape the workplace all in all. So that's how you could see the effects of a psychological injury on a worker. Okay, now, in that case, now that we've broken down how that could affect your business and how that could affect the worker, how do you actually support your workers during a time of crisis? Now, as you can see here, we've got three particular factors. Firstly, we've got consulting them. We also got seeking medical advice and report. Now, it's not a step process, because sometimes, well, most times, we see it in different order, right? In an idealistic world, we would love our workers to come up to us and have a chat with us and tell us what's going on. And through there, discussing with them what's actually happening, we could, change their approach. And then, from there, if they're not feeling any better or things are getting worse, to encourage them to go seek medical advice and report it to the insurer if they want to pursue a claim. Again, unfortunately, a lot of the times, when you're going through a psychological injury, a lot of workers don't feel comfortable to raise that. So sometimes we see them go for medical advice first, seek advice from the doctor. Then the doctor says, you know what, put in a workers' comp claim. They might still not be confident enough to actually speak to you and go straight to submitting a claim. Or you might see it the other way around. They go straight to submitting a claim, then they decide to speak to you about it, then they seek medical advice. It could happen either way. Now, with that, let's break down the claims process. So you understand if a worker indeed had a psychological injury from the insurer's point of view, what's the process that they do to ensure that they look at the claim properly? Okay, so the first thing that they do when a psychological injury has been addressed to them is they request for clinical records. So I mentioned earlier on in the webinar, one of the main things that they look at is work the main contributing factor to the injury, right? So clinical records will help them understand if the worker has any previous medical history with psychological illness or mental health issues. They'll send a questionnaire to the doctor, or if they've seen someone before, again, if they have a pre-existing illness, then they'll also send it to the specialist as well. Followed by an investigation process. So what that investigation process looks like is you'll get a factual investigator, so a private investigator that will interview those people involved. So we will see that commonly for bullying and harassment, sexual harassment claims, any type of claims where there's certain allegations against certain people involved, there will be a factual investigation. And they also the investigator will also review all the employment records, police records of the incident. And that's just to also ensure that the employer has done reasonable action within the circumstances presented. Followed by that will be the independent medical examination. So what that particularly entails is they'll refer your worker off to an independent psychologist or psychiatrist to examine them. So they'll get all the information presented from the clinical records, the investigation records, review that, and review them as well. Most times face-to-face. In recent times, due to the popular demand, a lot of it is through telehealth. So they'll be through FaceTime video calls there. And that's when they'll make their medical opinion on whether or not they deem that as work being the main contributing factor to their psychological injury. Through there, once we've obtained all that information, the insurer will review all the information at hand. Now, depending on the case, they might actually involve a legal representative as well, just in the case that there's a potential the claim can be denied. Getting legal involved is to ensure that they cover all bases and present a strong case there. And last of all, they make the liability decision. Now, that's not a be all end all. If you end up not agreeing or the worker doesn't end up agreeing on the outcome of the decision, they may lodge in for internal review. ICARE will review that, followed by CIRA and the commission if needed be as well. Okay. So now that we understand the claims process, providing support. How do you show up for your workers? Now, the first thing that we recommend is effective communication. When in the instance it arises that there is a psychological illness or injury presented by a worker, be involved. Let them know that you're there to support them. Liaise with the insurers, liaise with all parties there. Let them know so that way you could start to build that strong relationship. It's really important, especially when someone's going through a significant injury like that, that we show up as much as we can. Now, of course, be mindful of the situation, case-by-case scenario. If you're the employer and the worker's claiming that you're involved in an allegation, then obviously don't reach out to them. In doubt, seek advice. So if you feel that you may be stuck or you're not sure how to approach certain things, or if you realize that the worker is going through something a lot more significant and you're not sure, then seek advice. Reach out to your case manager, seek legal advice, or even managerial advice as well. How and when's the best time to actually approach your worker as well. And importantly, providing reassurance. In most cases like this, a lot of workers feel that they're exposing themselves or the company. So providing that reassurance that you're there, you're ready for them to come back to work whenever they're ready, and you'll provide whatever information they require. Providing that reassurance can go a long way for the worker as well. Okay, now let's look at risk and hazards. Now, I've separated this in different columns so you could understand, what would be filtered under that. So with psychological hazards in the workplace, the first thing that we would have the tendency to look at is the nature of their role. Some of the workers, some of the claims that come through could be because of pressures around their role, and that could lead from job demands, lack of role clarity, remote or isolated work, long hours. Oftentimes in the automotive industry, there is quite a shortage of skilled workers at the moment. So you might have the tendency to lean on other colleagues to make up for the work, especially if, the mechanic can't show up that day or you're short staffed. But that could have a long-term effect on the worker, causing them distress as well. The second thing is work environmental factors. So taking a look at your organization, the people within your organization, your structure. Do you show reward and recognition to your workers as well, particularly for those who have gone above and beyond, that have been in service for more than 10 years? How do you show up for your workers? And organizational justice. What is there any politics going on within the workplace? Can the workers approach you about an issue? And also your environment as well. For the mums and dad shops and for the bigger organizations, are you following work health and safety practices? Do you have a clean workshop? Do you have a safe working environment for your worker to come into? And from a psychological perspective there, do you have a good workplace culture where the worker could feel comfortable to come in and liaise with their colleagues, or would they feel isolated? That's some of the things to look into. Now, with the interpersonal relationship, this really comes down to the relationship and the support systems they have within the workplace there as well. With smaller workplaces, that could cause more issues, especially if you're a tight-knit team. There's a conflict that could cause a lot of issues in the long run. So how do you mitigate that? How do you mitigate the risks? How do you set boundaries with your staff? How do you create good working relationships? And lastly as well, work-related trauma. Now, within the industry, you don't often see this, but other industries, for example, aged care, you might see a lot of workplace trauma, disability, where, you're dealing with people that could be really irrational, reactive behavior changes. You might see more of that. But with workplace trauma, you're looking at exposure to certain events, violence and aggression, bullying and harassment, discipline, and even performance management as well. Okay, so mitigating the risk. So touching base on what we just spoke about, what can you do to prevent this from happening within your workplace there? So first, what are you doing to empower your employees? Are you providing them with the right tools and resources? Again, pointing at those people that have been in long service with you and your organization. Are you giving them that reward and recognition? Are you upskilling them so that way, as you know, with the automotive industry, particularly with the change of environment with electrical vehicles, are you upskilling your mechanics? Are you upskilling your workers to make sure that you are competitive and that they're always growing and learning? With your workplace environment, creating that positive workplace culture, leadership, employment incentives, even little perks of the business, even Christmas parties or little celebrations like Easter's coming up. What are you guys doing as a workplace to feel like you're one community? And then the resources as well. Sometimes we don't have all the resources to do everything in-house. So we look into external resources. So that could be employment assistance programs. They're fantastic. They help support workers, especially if they need to reach out to someone and get that advice as well, if they're not comfortable to reach out within the workplace. Medical assessment providers, for those who do pre-medical checks as well. That's really important to make sure your workers are fit and healthy. And also management systems. So looking at your processes, your procedures when it comes to work health and safety. What about HR? Do you have a grievance policy? Do you have a mediation policy? Is it up to date? And importantly, do your workers actually know what to do in a time of crisis as well? That's one of the main things that we need to look at, which is consultation. Do the workers actually understand and interpret the processes and procedures? Okay, now lastly, let's look into creating a safer workplace in the organization. Now, as I touched base a bit earlier, what I primarily do is look into all the injury management. My team also look into the WH&S. We pride ourselves in creating safer workplaces for our clients. So what we could do as well is, help if you identified throughout this webinar that there's certain areas that you might need fixing or improving within your business, that's okay. We're always learning and growing. And especially as businesses, as we focus on revenue and building and making stronger workplaces, also other risks also increase as well. So mitigating that risk sometimes could be a bit of a hassle if you don't have the tools and the resources to do it. So that's something that we do and what we do specialize in, especially with return to work programs. So if that's something you're interested in, or again, if you have something personal going on within your business or you need to seek advice, feel free to scan the QR code and then drop in your details and I'll be able to get back to you as well. Okay. And last of all, I also wanted to emphasize where I got the sources from and, different sources that could actually help you with your understanding around psychological injuries. So this webinar today is actually based off our In Emotion bulletin. So I recently did a bulletin, an article about understanding psychological injuries in the workplace. So it's more technical if you want to know a bit more about what it is, the ins and outs of it, and how to support your workers and everything we've touched base on today, but more in depth. Feel free to go to our Care Central hub, which will have the bulletin. So it's all on our Motor Trades Care website. And Care Central, if I mentioned a lot about documents and procedures, if you have if you're lacking any documents, or if you realize, oh, actually, I don't have a return to work plan. Oh, I don't have WH&S processes and procedures. Feel free to go to our Care Central hub. It's actually free for all our members there. So you could go in, register and download the documents that you do need as well. And also, if you need an assessment to look into what your business needs, that's something we can help you out with. And importantly, the accredited sources that we referred to in our webinar, in our Emotion series about psychological injuries, refers to CIRA. So they're our regulator in New South Wales, and also Safe Work Australia and iCare as well. All right. So that wraps things up for today. I truly appreciate you all taking out the time out of your busy schedules to join me today. I'm going to open up the floor now for any questions. So feel free to drop that. We've got a little bit of time now. So if you need anything, I'm happy to answer that. Also, just a heads up, I will be sending in our show notes today a copy of our slides as well. And we will be uploading the finalized webinar. So this will be available on our Motor Trades Care website. So if you want to go back on the webinar and join us, and go through what we've discussed today, or if there's someone in your organization or business that has missed out on today as well, you can feel free to forward the link to them. All right, so look, I'm just going to wrap that up for today. So again, thank you so much. Have a safe Easter break, and I look forward to hearing from you all. Thank you.